Greetings, dear learners. We were learning metallic poisons. Under that, we finished arsenic, lead, and mercury. Today, we shall learn remaining metallic poisons, that is, copper, iron, cadmium, and thallium. Copper is one of the essential elements for life and our body. We must have appropriate amounts of them in our diet and in the body. Remaining essential elements include sodium, potassium, magnesium, calcium, iron, manganese, cobalt, zinc, and molybdenum. Metallic copper exhibits a lustrous appearance and is an odorless solid distinguished by its unique golden color or red-brown hue. As an essential trace element, copper ranks the third most abundant in the body and serves as a crucial catalyst for heme synthesis and iron absorption. Metallic copper is non-toxic or minimally toxic. Toxicity is associated with the copper salt. The toxic salts of the copper are copper acetoarsenite, also known as Paris green, copper arsenite, Shisley's green, copper subacetate, verdigris, copper sulfate, that is blue vitriol, and the copper carbonate, that is mountain green. You can see the color of the blue vitriol, that is blue color copper sulfate, and many times patients present with the poisoning with copper sulfate or blue vitriol. Then the uses of different copper salts. Copper is commonly used in our day-to-day life and it is part of many industrial processes, industries, chemicals, and many other things. So this table depicts the uses of different copper salts as well as elemental copper. Elemental copper is used as an industrial metal in thermal and electrical composites, as an important alloy to bronze and brass, money metal, electroplated coatings, and undercoating in cooking utensils or other products. Corrosion resistant plumbing pipes used for building construction and has application in industrial machinery and in automobiles. Copper's contraceptives for the intrauterine devices is well known. Copper oxide, that is also in the rust, is used as a catalyst and pigment for the ceramic, glass, enamel, and the porcelain. In copper metallurgy, pyrotechnics and weldings, and in manufacture of rayon found in batteries, electrodes, desulfurizing oils, paints, fungicide, and insecticide, it is being used. Copper acetate is as a paint. Copper acetate is used as a paint pigment in insecticides, fungicide. Copper carbonate is used in pigments, pyrotechnics, insecticide, fungicide, and brass coloring. Copper chloride is used as disinfectant in metallurgy, for preservation of wood pulp, in photography, in water purification, and as a feed additives. Copper nitride is used in the pharmaceutical preparations and paints, varnishes, and enamels. Copper cyanide is used in electroplating of copper on the iron. Copper sulfate or sulfide is used as fungicide, molluscicide, and wood preservative. Also used for water treatment as bactericide and algicides, as mordant in leather tanning and the hide preservation, and in some fertilizers. Medicinally, it is used as an emetic and in several intrauterine devices. Medicinally, it is used as an emetic and in several intrauterine contraceptive devices. Then its fatal dose for the copper sulfate is around 10 to 20 grams. Fatal period is 1 to 3 days. Regarding toxicokinetics, the important facts are: the recommended daily intake of dietary copper ranges from 2 to 3 mg per day, while the actual requirement is only 0.8 mg per day. Copper plays a crucial role in functioning of enzymes such as catalase and peroxidase. In serum, copper exists in two forms, one bound to albumin consisting of 7% total serum copper and other bound to copper enzymes, ceruloplasmin, that comprises around 93%. Urine typically contains only traces of copper ranging from 5 to 25 microgram per day. Approximately 0.1 to 1.3 nanogram of copper is excreted through bile daily and eliminated in fishes. The total body copper content is estimated to be about 150 milligram. Copper is absorbed through the gastrointestinal mucosa as well as intact skin. Then coming to the mechanism of action, glutathione inhibits the sulfhydryl groups of various enzymes, including G6PD and the glutathione reductase, resulting in their reducing the free radical scavenging capacity, that is having the antioxidant properties, and that causes oxidative process in the body. Then another way of their effect is by intravascular hemolysis, that is done by inhibiting the G6PD enzymes. Then another mechanism of its action is through the inhibition of the sodium potassium ATPase pump that causes the increased cell permeability through all the organs. Then it causes rhabdomyolysis by causing the skeletal muscle damages. By this way, the effects of the copper are seen on the body. Then the certain hereditary conditions of the copper metabolism are there that predisposes an individual to the copper toxicity and the copper deficiency. One condition is the Menkes disease. It is a rare sex-linked genetic defect in the copper metabolism resulting in copper deficiency in male child. It is characterized by distinctive hair, failure to thrive, severe mental retardation, neurological impairment, connective tissue dysfunction, and death, typically occurring between 3 to 5 years of age. Bones exhibit osteoporosis with flared metaphyses of the long bones and the bones of a skull. Extensive degeneration occurs in the cerebral cortex and white matter. The gene responsible for the Menkes disease are ATP7A that belongs to the family of ATPase and functions as a copper transporter. Deficiency in this copper transporter obstruct the copper transportation across the basolateral membrane of the intestinal cells into the portal circulation, resulting in copper accumulation in the enterocyte, and the systemic deficiency of the copper in the body occurs. So this genetic condition is the responsible for the copper deficiency in the male child. Here in the picture, we can see the distinctive hair appearance and the neurological developmental abnormality in the child. Then another hereditary disease with the copper metabolism is the Wilson's disease. This is an autosomal recessive genetic disorder of the copper metabolism that is characterized by excessive accumulation of copper in the liver, brain, kidney, and the cornea. In this case, serum celluloplasmin level are low, while the serum copper not bound to the celluloplasmin is elevated. Urinary excretion of the copper is high. Clinical abnormalities of the nervous system, liver, kidneys, and cornea are directly related to the copper accumulation. Patients with the Wilson disease exhibits impaired biliary excretion of the copper, which is believed to be the fundamental cause for the copper overloads. Liver transplantation can reverse the abnormal copper metabolism, confirming that the primary defect in the Wilson's disease lies in the liver. Clinical improvement can also be achieved through the chelation therapy. At genetic level, this has been found that this occurs due to the abnormal allele of the ATP7B gene at both loci of the chromosome 13. This is the case with the toxicity of the copper. As you can see in the picture, the eye of the person with Wilson's disease showing the Fisher ring in the eye, that is the copper deposition at the cornea. Then copper intoxication leads to the various symptoms including muscle pain, stomach ache, vomiting with bluish or greenish tinge, diarrhea, acidosis, pancreatitis, methemoglobinemia, blood cell destruction, jaundice, reduced urine output, kidney failure, seizures, confusion, and unconsciousness are the common features seen in the acute copper intoxication. in hepatic system, liver enlargement, liver tenderness, elevated liver enzymes, and jaundice may appear a few days after the consuming copper salt. Around 20 to 40% of the individual with acute copper sulfate poisoning experience acute kidney failure, primarily due to the blood cell breakdown, that is hemolysis, that is the hemoglobin getting concentrated at the renal system. This condition can occur with other copper salts as well. Reduced urine output and the increased blood urea nitrogen level may occur within 24 to 48 hours after the acute intoxication. Inhalation of copper dust or fumes can cause coughing, a sore throat, and conjunctivitis. Copper oxide is a known cause of the metal fume fever. We will be coming to metal fume fever in detail. Eye exposure to copper may result in conjunctivitis, corneal ulcers or cloudiness, and swelling of the eyelids. Foreign bodies made of the copper or the copper alloys lodged in the eye can lead to inflammation, abscess, severe injury, or loss of the vision. Over time, dissolved copper may spread to the lens, cornea, and iris, causing a greenish brown discoloration of the front capsule visible under the microscope. On prolonged inhalation of copper sulfate spray used as insecticide in vineyards can lead to the lung condition known as the vineyard sprayer's lung disease, characterized by histiocytic granulomatous lung inflammation. Liver damage is also commonly observed. Long-term exposure to the swimming pool water treated with the copper-based algicides can cause hair to turn green. In some developing countries, churches distribute a spiritual green water to the follower which contains the copper sulfate. Ingesting this water can lead to the severe toxicity and even death. Cooking with the copper and the brass cookware can lead to the copper poisoning due to the formation of verdigris. Additionally, copper poisoning may occur from the leaching of the copper containers used to store acidic beverages like carbonated water and citric juice. Wilson's disease, as we already talked, is an autosomal recessive genetic disorder characterized by ceruloplasmin deficiency and is marked by chronic copper toxicity. A distinctive feature of this condition is the Kasher-Fleischer ring, a peripheral corneal discoloration caused by the copper deposition that we saw in the last picture. Patients with the Wilson disease may also exhibit sunflower-like discoloration of the anterior layer of the lens. Workers exposed to the fine copper dust may experience the metal fume fever, wheezing, and abnormal lung sounds. Oral exposure to the copper may cause the breathing difficulties. Skin exposure to the copper can result in severe irritation, itching, redness, dermatitis, and eczema. Then, as we talk, Vineyard's sprayer lung disease. Bordeaux mixture consists of the copper sulfate blended with the lime that is commonly sprayed in the vineyards to combat the fungus on grapes, melons, and the berries. Originating from the Bordeaux region of the France, it is locally referred to as Bouli Bordeaux. Vineyard sprayers chronically inhale this mixture, leading to development of interstitial pulmonary fibrosis and histiocytic granulomas containing copper. Additionally, many workers experience malignancies, underscoring the carcinogenic potential of the copper exposure. Then the chalcosis lentis is seen in case of chronic poisoning that presents with the deposition of copper in the cornea or the lens, turning the greenish brown in color. As you can see in the picture, there is the brownish deposition of the copper on the cornea. Then the workers working in certain factories may develop the greenish discoloration of hair due to deposition of the copper on their hair. Then for the diagnosis of the copper poisoning, after acute copper salt poisoning, a standard laboratory test should encompass evaluation for hemolysis and hepatotoxicity. It is essential to assess the patient's electrolyte level and hydration status. Regarding the specific parameter that shall be looked upon is the serum ceruloplasmin level. Serious toxicity is indicated by value of the 35 milligrams percent or lower at the 24 hours of the exposure. Then blood copper level is the important parameter. Elevated levels exceeding 1.5 milligram per 100 ml suggest the possibility of serious toxicity. Normal level of copper in blood ranges 1.09 in case of the man and 1.20 milligram per liter for the non-pregnant woman and 2.39 milligram per liter for the pregnant woman. Then urine level monitoring of the copper shall be necessarily done. Routinely, the daily copper excretion in urine typically remains below 0.6 micromole per day. If it exceeds its value, then it is suggestive of the excess copper in the body. Radiography may be helpful as metallic copper appears radio opaque, offering diagnostic potential through X-rays. However, copper salts don't exhibit the radio opacities and could not be seen on the X-ray. Then management strategy for the acute copper poisoning includes oral administration of egg white or milk. This aids in the copper detoxification, forming an albuminate. Then stomach wash shall be done using potassium ferrocyanide solution to convert copper salts, especially copper sulfate, into the cupric ferrocyanide. Serum total copper concentration measurement shall be done, monitoring the improvement. Blood should be saved for assessing serum total copper concentration with a reference range of 10 to 21 micromole per liter. Clinical signs may not always correlate with the concentrations. The chelation therapy is of much use. The penicillamine is the drug of choice or the chelator of choice for the management of the copper toxicity. Penicillamine is given in the dose of 1000 to 1500 milligram per day, divided every 6 to 12 hours before meals. Then in pediatrics patient, initially start with the 10 milligram per kg per day and gradually increase up to 30 milligram per kg per day, divided into 2 to 3 doses as the patient tolerates. Then the dimercaprol or British anti-leucide is although have the less efficacy but is beneficial where the D-penicillamine is not tolerated by the patient orally. In those cases, British anti-leucide may be given. Dimercaprol or British anti-leucide, although it has the reduced efficacy in the copper toxicity, but it is useful where the D-penicillamine is not tolerated orally by the patient due to the vomiting or gastrointestinal injuries. In those cases, British anti-leucide is the beneficial agent of choice. It is given in the dose of 3 to 5 milligram per kg per day, deep intramuscular, every 4 hourly for 2 days, then every 4 to 6 hours for additional 2 days, then every 4 to 12 hours up to the 7 more days. Then the calcium sodium editate may also be given. It is given in the dose of 75 milligram per kg, 24 hours deep IM or slow IV infusion and administered in 3 to 6 divided doses over the 5 days of period. Then certain other treatment measures include the symptomatic measures like considered antacids and the ranitidine to prevent gastric erosions and dopamine for the shock management. Hemodialysis useful in the early stages for poisoning when free copper is still circulating in the bloodstream and in patients with the renal failure. Liver transplantation may be of success for the patients facing the life-threatening hepatic failure, particularly the patients of the Wilson diseases. Then overall, we can summarize the whole management strategies through this chart. We have to go for the lab investigation, then the type of the exposure, if it is the inhalational injection or on the skin, then eye shall be irrigated with the 0.9% NS for 15 minutes. Then the skin shall be washed and with the soap and clothes shall be removed. Hair shall be treated with penicillamine 250 milligram in 5 ml of water and the 5 ml shampoo, and it shall be washed. Then in case of renal failure, hemodialysis may be attempted. Then after the lab investigation managed symptomatically, ABC stabilization and elective intubation shall be done. Then gastric lavage with 1% potassium ferrocyanide is of some help. Then demolitions like egg white and milk may be given. Chelating agents, D-penicillamine is the best chelating agent for the copper poisoning. Dimercaprol and the calcium sodium acetate may be given. In case of hepatic failure, liver transplantation shall be done. And the patient, if it has the methemoglobinemia, then treat the methemoglobinemia with methylene blue 1 to 2 milligram per kg per dose IV, hyperbaric oxygen, ascorbic acid. Then in case of death of the person and the postmortem examination, although not very characteristic findings will be seen, most of the findings are non-specific. However, we may have certain findings that may be suggestive of the copper intoxication. That includes the greenish blue froth observed around the mouth and the nostrils. Gastric mucosa displays congestion, erosion, swelling, inflammation with greenish blue hue. So here the greenish blue hue in the froth and the lining of the gastric mucosa is of suggestion for the copper poisoning. Then the liver exhibits softness and the fatty infiltrations. Kidney shows degenerative changes primarily in the proximal tubules that may be seen on the histopathological examination. Certain histopathological stents may be also tried for the increased concentration of the copper in the tissues. Skin appears yellowish due to jaundice. Blood will indicate the signs of hemolysis. After the clinical suspicion, history and the postmortem examination, the final confirmation shall be done by the laboratory examination.